form, and how is this changed in the congestive heart failure? In normal condition, the hydrostatic pressure at the arterial end is 40 mmHg and at the venous end is 10 mmHg, and the oncotic pressure is 25 mmHg, where this pressure causes to leak out the fluid from the plasma into the interstitial space of the tissue. This fluid which is leaked out from the plasma into the interstitial space of the tissue is known as tissue fluid, where this will later go back to the capillary through the venous end. But in the case of congestive heart failure, the fluid which is leaked out from the plasma into the interstitial space of the tissue won't go back to the capillary, where it will accumulate in the interstitial space of the tissue and cause edema. The reason for this I will explain in the next slide. These are the X-ray images of a normal human body and a person with the congestive heart failure. When comparing with the normal human body, what we can see is the person with the congestive heart failure is having edema in his whole body, and this causes his diaphragm to push up and his lungs to become smaller, where the accumulation of fluid in the lungs causes shortness of breath, especially during exercise and when lying flat. Okay. This is a simple video which is showing how the tissue fluid normally form and how it is changed in congestive heart failure. In a normal condition, the capillary pressure and the oncotic pressure is balanced, where you can see the fluid which is fluid from the blood plasma is leaking out into the interstitial space of the tissue and will then goes back to the venous side of the capillary. Venous side of the capillary. Okay. Hence, the fluid which is Hence, the fluid which is losing out from the plasma is equal to the fluid which is coming in the venous side of the capillary and gained by the plasma. So there is no net change. This part of the video is showing what happens in the congestive heart failure. In the congestive heart failure, the capillary pressure and the oncotic pressure becomes imbalanced, which means the capillary pressure is still same, but the oncotic pressure becomes low, where this results the fluid from the plasma to fluid which is leaking out from the plasma to accumulate in the interstitial space of the tissue, and it then causes edema. What we can conclude from this is, whenever the hydrostatic pressure is greater than the oncotic pressure, the fluid will leak out from the capillary into the interstitial space of the tissue. But when the oncotic pressure is greater than the hydrostatic pressure, the fluid will then goes back into the capillary. But if not, the fluid will accumulate in the interstitial space of the tissue and thus cause edema. Next, Angel will talk about the mechanism of action of salicylate derivative.
Okay, so here she talked about the formation of water retention. So here what I'll be talking about is thiazide diuretics and how they help to alleviate the symptoms of congestive heart failure, which is edema. Okay, so here we see what happens when someone with congestive heart failure, they consume thiazide diuretics. What is the condition of the patient? Okay, diuretics, there are basically three types of diuretics. We have loop diuretics, thiazide diuretics, and potassium-sparing diuretics. So Today I will be focusing on thiazide diuretics. Thiazide diuretics works in the distal tubule and the connective segment of the nephron, which is found in the kidney. Okay, thiazide diuretics are a group of drugs which is derived from benzothiazide. Its mechanism of action is by inhibiting sodium and chlorine resorption back into the bloodstream. Okay, why sodium? What's the importance of sodium? Sodium is a co-transporter of water. So when sodium goes back into the blood, it brings along water. Why don't we want sodium to be resorbed back? That is because the patient is already suffering from edema. Edema, so it's too much of water in the interstitial spaces. If you're going to bring in more water in, it's just going to worsen the symptoms. Okay? However, it may cause hypokalemia and increase serum uric acid. It decreases the risk of MI, congestive heart failure, and stroke. Why thiazide diuretics? Thiazide diuretics is a preferred drug of choice because it is cheap and affordable for the general public. It is also the first choice of drug for hypertension treatment. Why hypertension treatment? Is because people with hypertension, they have high blood pressure. Okay, once again we look, mechanism of thiazide diuretics is by inhibiting sodium transport and chlorine being absorbed back. This reduces the blood pressure and peripheral resistance. Okay, here we look at the distal convoluted tubule of the nephron. This is the lumen and this is the blood. So here sodium and chlorine is resorbed back together with water in a normal condition. Okay, however, for a person who consumes thiazide diuretics, here it blocks the sodium chlorine symporter and it doesn't allow the sodium to be resorbed back. So it doesn't allow the water to be resorbed back. This decreases the blood volume and it decreases the workload on the heart. Here we'll be just looking at a little video on thiazide diuretics in normal cases. Okay, here we see the sodium chlorine co-transporter, and this is the interstitial space, and this is the lumen. So what happens is that sodium and chlorine enters through the symporter and enters the interstitial spaces through the chloride channels and by the sodium channels together with water. So water here is being resorbed back. What we're looking here is the normal case of resorption in the distal convoluted tubule. So for a person who consumes thiazide diuretics, as mentioned earlier, the thiazide diuretics block the co-transporter and it doesn't allow the sodium to be resorbed back. So the sodium is not resorbed back, the chlorine and the water is excreted in the urine. Okay, so as a summary, a person with congestive heart failure, they may experience symptoms such as fatigue and edema, pulmonary edema, and it can be treated by thiazide diuretics for the symptoms. However, there's no proper treatment for congestive heart failure in itself, except for a transplant of the heart. Okay, I'm Angeline. This is Sue. This is Honey and Parmes. Thank you for your attention.